Hello, my name is Karen Hughes, and I am the Domestic Violence Clinical Services Coordinator for the Life Crisis Center, and I want to welcome you to Life Crisis Today. Suicide is not an easy topic. It's not an easy topic to talk about. It's not an easy topic when you have family members or friends or a loved one that you're worried about, or if you're having thoughts yourself. It's not easy. So we're going to talk about that today. And with me is Kimberly Christopher. She is the Life Crisis Center's Hotline Director. Welcome, Kimberly.
Thank you for having me.
Suicide's not an easy topic, like I said.
Yeah, no, it's not.
Let's talk about suicide first.
Okay.
What are some of the signs of someone who might be suicidal?
Well, when it comes to that, there is no one single cause. But some of the things would be, let's say, a person that has untreated depression, mental health related issues. Those are the higher factors of suicide. Other things would be someone would just come out and say, I want to kill myself, or I want to die. Right. They will even go to lengths of going online or researching ways to actually kill themselves. They will often express feelings of being a burden to others. They may feel isolated. They feel alone, like no one cares. There's no one to talk to about their problems. And I would also say to look for a change in a person's behavior. They may display extreme mood swings. One day they may be, the happy-go-lucky person that you know, and another day they are withdrawn, and they may express some anger. Anything that's out of the ordinary or isolating, absolutely. Yeah. So those are just some of the signs of someone that may be thinking about suicide.
Yeah. If I'm one of those people who have loved ones that I'm so worried about, what can I do to help?
I would say the number one thing is to be a support system. Let them know that it is okay for them to express how they are feeling. Judgment-free, of course. We don't want to give our own thoughts and suggestions about the way that you may feel about suicide. You want to acknowledge their feelings. Also, if you would know of any type of resources to give them, such as like a crisis line or a helpline. Right. Sometimes when you say crisis line, that can be a little bit intimidating. So how about just say, if you know of a helpline, warm line, someone where they can call and talk to, I would suggest that. That way they can call and get the direction that they need to get the mental health treatment that they need.
That I'm there for you.
Absolutely.
Type of message.
Absolutely,
Let's get you some help.
Yes.
Yeah.
Yes.
You mentioned a lifeline. Yes. I know there's the National Suicide Prevention Lifeline, and the Life Crisis Center is one of the people who answers that lifeline.
Yes.
Let's talk about that.
Sure.
And there's some changes happening to the lifeline.
Yes, there has been some changes. The National Suicide Prevention Lifeline is now called 988. So the important thing to remember are those 3 digits, 988. It is called 988 Suicide and Crisis Lifeline. So when someone is to call that number, it offers a 24/7 call, text, and chat access to a trained crisis specialist. So that crisis specialist will help people that are experiencing suicidal, substance abuse, mental health crisis, or any emotional related distress. Right. So they will talk to them and kind of guide them into the right direction. That line is also for people experiencing mental health crisis now. It's basically a new way to access the services, just by those 3 simple numbers.
So it's not just suicide. I don't have to be suicidal to call 999.
Absolutely no, you do not. That line, yes, that line is for anyone that wants to call in and talk about any concern, any issue. They are welcome to call that line, and they will get the same compassion compassionate and caring treatment as they would if they were to call what they know of to be the National Suicide Prevention Lifeline.
So is there a difference between 988 and the National Lifeline?
No, it is not. They have the same services. 988, it is not a new services. It just expands on the existing services of the National Prevention Lifeline is what it does. It's like I said before, it's a new, shorter and easier to remember way to access an expanded network of crisis call centers.
So if I were to call 988, what can I expect?
You can expect a caring and compassionate and a trained crisis specialist. They will answer the line. They will listen to the caller. They will understand how their particular problem is affecting them. And they will also provide and share resources. The thing is, a lot of people don't realize that when you have a mental health illness, there are an abundance of resources that are out there. You just need guidance, and the crisis line will give you that guidance, and they can connect you to the resources that you may need.
So has the National Suicide Prevention Line gone away, or can they still access that if they wanted to? Well,
the Lifeline 10-digit number is still available. Simply call 1-800-273-8255. And again, that will link you to the National Suicide Prevention Lifeline. 24/7 access, as always. It's just that, again, 988 is the 3-digit number that provides access to the Lifeline. So you have two ways of being connected to it. The Lifeline is still available and up and running and working.
Okay. Well, 988, that's so easy to remember. And like 911, you know, we think of 911 to call the police, to call the fire department, ambulance. 988, what's the difference between 988 and 911?
Well, 988 was established to improve access to crisis services. It's in a way that it meets the growing needs for mental health and suicide population, whereas 911, that's more along the lines of public safety. With 911, their focus is on emergency medical services, fire, rescue, ambulance, that kind of thing.
So this is, I might want to think of it like a mental health emergency. If you're having that, call 988.
Absolutely.
Versus the physical, call 911.
Yes.
Okay.
Yes.
So is 988 available everywhere? And all the states, the states are doing it.
988 is available across the U.S. So anyone that is in need of the services that 988 provides, again, they can call, chat, or text and be connected.
I was just going to ask that. It's not just calling. You don't just have to call.
No. All services are 24/7, so you can call 24/7 hours a day, pick up the phone, dial 988, and you'll be connected with a crisis specialist. You can text 988, or you can chat, and you can do that by simply logging on to www.988lifeline.org, and you will be connected with a crisis specialist.
Sometimes, I know when I've worked with some clients, they're afraid that the police are going to be called if they're suicidal and they're going to be taken to the hospital and being committed, you know. Is there that risk if they called 988?
No, they're not. Intervention is the last resort. And when someone does call the Lifeline, you would be surprised the amount of people that are saying, are you going to call the police? Please don't. And we let them know, no, we are not going to call the police if we can work together, figure out what your needs are. We try to always de-escalate the problem that a caller has. Calm them down. You know, be encouraging, be supportive. A lot of times that works, and the reason why I say that is a lot of times on the Lifeline, you will have someone that calls in, they are so overwhelmed. They have all of these different life issues or problems that they are going through. And some of them feel that, that's it. I just don't want to be here.
Yes. I can't handle this anymore.
I can't handle this. I just don't want to be here anymore.
Right.
And by the time that they speak with one of the crisis specialists, we listen. Listening is very important. A lot of times, Karen, that's all that they want.
Right.
They just want someone to talk to.
Right.
They don't feel like they can talk to family anymore. They feel that they are, like I said before, a burden to family.
Yeah.
The Lifeline or Hotline, crisis line, it is an outlet for a lot of people.
Yeah.
So they have gone from heightened risk of suicide when they first call in to venting it all out, talking. We come up with a safety plan for them. And by the end of the call, they're okay.
Yeah.
And they know that they can reach out and call us again on the Lifeline if they need to.
That we're safe people to talk to.
Yes, and they absolutely will.
Yeah.
They will repeatedly call.
Yeah.
So
I also find that sometimes they just need resources because they are so overwhelmed with all their life challenges.
yes,
And that's something we do as well, is give resources.
we do. So if someone is in need, let's say, of food or shelter or mental health resources, if they want a number to their local mobile crisis so they can give to a family member that may be having a mental health breakdown, we will provide them with resources so that they can get connected to the crisis care services.
Right. Now, if someone's not having a mental health and just want resources, I know there's another program.
It is.
It's called 211.
Yes.
And what is 211?
So 211 Maryland is information and referral for human and health services. Again, 211 is also 24/7. You can dial 211. You can text 898-211 by using a mobile device, and you can be linked to resources. And what I mean by that is, let's just say someone calls into 211 and let's just say they say, I need help seeking substance abuse treatment, inpatient, outpatient detox, or a therapy for mental health, depression, bipolar, the whole scope.
Right.
Food, shelter, clothing. The 211 Maryland Resource Database has over 7,000 resources for human and health services.
Wow.
So we can look based on their zip code because that database is set up geographically.
Okay.
And we can provide them with resources that is closest to them in their area.
Okay. Okay.
So that they can go and get the help. So yes, it's more than just mental health. It is everything in the scope of human and health services for 211. So yeah, I always encourage everyone to call there if they need it.
Right. Well, we've been talking resources. Let's repeat some things.
Sure.
What is the National Suicide Prevention Lifeline number again?
That number is 1-800-273-8255.
Okay. And we've talked about 988 and 211.
Yes.
Is there, and the Life 988, what's the www.988?
www.988lifeline, that is the
.org?
.org.
Okay.
Yeah, I'm sorry. I'll say that again. www.988lifeline.org. That is the website where it has a lot of educational information for suicide, mental health, things that you should know, things that we just mentioned, looking for the warning signs, how to help a loved one in need. It has a lot of interesting and helpful information if you log on to there.
Are there other resources that we haven't talked about yet?
For mental health, I would say that NAMI is a good one, and that is the National Alliance of Mental Illness, and they provide a website that is full of educational and again support services for everyone that may be struggling with mental health. There are some support groups out there as well for mental health. So to reach NAMI, they can simply dial 1-800-950-6264.
Okay. Okay. Great.
Okay.
Great.
Another resource I think is good to mention is Maryland Crisis Connect. Connect. So we talked about before, whereas some people may not feel comfortable dialing a number that has suicide or crisis, there is Maryland Crisis Connect.
Okay.
Maryland Crisis Connect, it is a form of a crisis line, but it's also a talk line, warm line.
Okay.
That number is 1-800-422-0009.
Okay.
And it is also a 24/7 number where people can get connected.
Okay.
So yes, you can dial any of those numbers and you will also receive some resources,
Yeah.
or they may direct you to call 211 if they don't have your local mental health agency or something like that on hand.
Okay. Anything we've forgotten? We've gone over a lot of information. We've
We
gone over
have.
988. We've gone over 211. Suicide
I would
prevention.
just like to add that if they dial the crisis line 988, you are never put on hold. Some people feel that if I dial there, I'm in an extreme mental health emergency. I don't want to call and listen to, that elevator music, so to speak.
Yeah.
You will not receive that when you dial 988. You're actually going to you'll listen to a greeted message, and then you will be immediately connected to your local crisis center. If that crisis center is not available, what's going to happen is you will never hear anything. You'll just automatically be routed to one of the national crisis centers.
Okay.
So no one is ever placed on hold.
Okay. Just automatically it happens.
It just automatically
Magic.
happens
Great.
very, very quickly.
Good.
You will never even know, but
Right.
I just wanted to get that out there. It's
Great.
important.
Great. Yeah.
Yeah,
That help is there.
certainly. Yes, it is.
Yeah. Well, Kimberly, I want to thank you. Thank you for coming today and explaining all this.
Thank you for having me. It's my
Yeah.
pleasure.
Great way to get that help if somebody needs it.
Absolutely, it is.
Yeah, thank you. And I want to thank you for joining us. As I said at the beginning, suicide is not an easy topic, but there is help. Please reach out. There's a way to get help. 988 is there. But the Life Crisis Center has a bunch of resources too. If you want to reach us, our hotline number is 410-749-HELP. Again, that's 410-749-4357. There's 211-988. We have a website, www.lifecrisiscenter.org. We mentioned text to chat as 898-211. Now you do have to put your zip code for that one. Social media, we're on Facebook, we're on Instagram. There's lots of ways. Please reach out. Don't feel like you have to go alone or there's nobody to talk to. There are people out there. Thank you. And I also want to thank PAC 14 for helping to make this show available.